That's right. Dick and Ellis, as the plan was unveiled today, there was virtually no talk of taking aim at the actual drug makers to lower the prices. The president plans to target the so-called middlemen and drug lobby industry instead, which he says is getting rich as Americans struggle to pay for their meds.
My administration is launching the most sweeping action in history to lower the price of prescription drugs for the American people.
He's called it one of his greatest priorities. And this afternoon in the Rose Garden, President Trump announced plans to keep the promise, saying previous administrations have turned a blind eye to the abusive cost of medication in America.
This is a total ripoff, and we are ending it. We are getting tough on the drug makers that exploit our patent laws to choke out competition.
We need a system for prescription drug prices that puts American patients first.
Both the president and the Health and Human Services Secretary point out the current system often takes advantage of patients when it should be taking care of them, outlining the 4 major problems the president's plan will address: high list prices for drugs, government rules that get in the way of the Medicare program, foreign countries freeloading off American innovation, and high out-of-pocket costs.
First, increased competition. Second, increased and better negotiation. Third, incentives to actually lower list prices. And fourth, lowering out-of-pocket costs.
That will mean saving patients more money by offering more generic drugs in the medical marketplace. And at a time cancer drugs can cost some patients more than $400,000 a year, the administration plans to push the FDA to force drug makers to disclose the price of their medications in TV commercials.
It's material and relevant to know if it's a $50,000 drug or a $100 drug, because often that patient is going to have to bear a lot of that cost.
The plan would also ban the gag rule at drugstores, which prevents pharmacies from telling their customers how they can save money on their medications, also while putting pressure on the FDA to speed up the approval of over-the-counter medication so patients have more options. There's no timeline yet, though, for getting any of this passed. Dick?
Jessica, thanks very much.